There are renewed calls for more domestic manufacturing of antibiotics as a nationwide shortage threatens to drive up hospital admissions. Julia Bradley joins us now live. Julia, how bad is the shortage?
Well, Danica, this shortage of some really common antibiotics is incredibly bad. There's a dire shortfall affecting large parts of not only the country but also the globe. And these are some pretty critical medications, including amoxicillin. That's a drug that's used to treat pneumonia, strep throat and other infections. Also, the contrast dye that's used for medical imaging is also in short supply. And also epilepsy medication, a drug used for palliative care of cancer patients, also considered to be in short supply. So all up, more than 390 medications are in short supply. That's according to the Therapeutic Goods Administration. 44 medications, particularly antibiotics, facing that critical supply issue. So this is all being driven, according to the TGA, by an unprecedented increase in demand for antibiotics and other types of medications, really worse felt when it comes to liquid antibiotics that are primarily used among young children. And also some of the key ingredients for some of these antibiotics is also in short supply. So that's really making for these wider supply issues as well. So we're being warned by medical professionals that this could lead to an increase in hospital admissions, particularly for our elderly population and also for young children. And it could also just take longer to clear up some people's infections, because as a result of this shortfall, some pharmacists are now resorting to mixing up their own medications as an alternative, and this is as a result driving up prices. Some consumers now being forced to pay up to 7 times what they normally would for some pretty important medication. The good news is that in a few months' time the supply issues should level out, and that's because a new agreement has been reached where manufacturers have to hold on to between 4 to 6 months' supply of some of these crucial drugs. But in the meantime, there could be a lot of hurt on the way, hospital admissions possibly increasing, and it could also delay people's return to work as well.
Julia Bradley, thank you.